So my name is Dr. George Davis. I'm a physician in North Houston, up in the Woodlands, Texas, and I have a wellness center with my wife, and we do a lot of nutrition and vitamin supplements, bioidentical hormones, as well as a med spa, and anti-aging and regenerative therapies as well. So we were looking at incorporating stem cells into our practice, and honestly, I looked through the internet for a place to train, and R3 came up as like the best agenda in the shortest amount of time. It looked like it was probably the best thing that I could do for my practice.
And you think you made a good choice?
So definitely I did. So far it's been great. I've learned a lot of great procedures such as joint injections, seeing the O shot and the P shot, learning about the use of exosomes and stem cells and PRP. And a lot of these I can take back and start pretty much immediately when I get back to my practice. I even got my own joint injection on my shoulder, which will hopefully help some of the pain I've been feeling in that from an injury from weightlifting.
One of the things that we hear is that because people get a procedure, they then get to relate to patients with how they feel and have done from the procedure with what they're experiencing. You think that'll be helpful?
Oh, definitely, because anytime I get a procedure in our office, I like to show that to the patients, such as getting an injection here. I try to do as many procedures in my own office, so getting one here was even like a bonus. These procedures I can learn are fairly much in my armamentarium already that I can use, and when I take it back, it's just learning the actual procedure using the stem cells or the exosomes.